This is Robert Kraft, and I'm your host on SNN.Network. And joining me right now is Scott Montgomery. He is the CEO of Wellteq Digital Health Inc. It's a publicly traded company. The symbol is WTEQ on the CSE. Scott, thank you for joining me today. How you doing?
Yeah, great to be here, Robert. Thanks for having us.
It's great to have you. So this is our first time doing an interview together. So I'd love to start off with, can you provide us a quick overview and history of the company?
Yeah, sure. Look, Welltec is a digital health platform. Our core customers are employers who then in turn buy our software and offer it to their employees to help make them happier, healthier, and less costly. And then insurance companies for exactly the same reason. So we engage people towards better health habits through our software, and it helps make them happier, healthier, and less costly as an insurance policyholder.
Very good. All right. Well, tell us a little bit about the platform. How does it work? What's part of the platform that makes employees happier and healthier?
Well, you've got the mix, right? If it was up to just information, we'd all be billionaires with six packs because we've got Dr. Google to tell us everything. But where we come into it is a mix of community. So we've got individual and group programs. We're very holistic in our supporting programs. So mental health, physical health. We've got financial wellness programs within our ecosystem. So it's a way for people to almost navigate their own journey to a degree towards those health improvements, which ultimately drive health outcomes. So looking at some of the feature sets in there, we connect with main brand wearables. So Garmin, Fitbit, Apple Watch, the main brands. We have rewards and incentive programs. So if you achieve some of these health and engagement goals, then you can earn, rewards, financial rewards, which is a great incentive. And then we can link through to telehealth. So if you do need that escalated level of care, you can have a little bit of fun and go about your health journey. But if you want to speak to a telepsychologist or speak to a GP, then we can facilitate that discussion all through coming through our platform. So it's a bit of a one-stop shop at the wellness end of town, and then we can drive that escalation of care as and when needed.
Very good. So where did this idea come from? We talked offline. You're one of the founders of the company. So where did the idea come from, and how did you get to where you're at today?
Yeah, look, so I'm an exercise physiologist by trade. So I've worked with elite athletes, run insurance case studies, and my previous company, we actually built one of Australia and New Zealand's largest workplace health companies, where we put allied health professionals and medicos physically inside a business to run face-to-face consults. So building and growing that to an exit after 8 years or so, sat back and thought, look, if we could wrap some technology around a lot of those programs and behavior change systems, we could bring affordability and accessibility to corporate healthcare. And that's where it started. So I moved the company up to Singapore from Australia, and we've built that out to now touching over 30 countries, 12 languages, and we're expanding that care and corporate wellness, insurance wellness, and ultimately to become a proactive primary healthcare.
I mean, what was the impact on COVID-19 to your business? I would think that there would be a lot more corporate interest in something that they can implement, HR teams can implement remotely, and teams can interact with remotely, right?
Look, totally. And what was really interesting is that there's been this sort of perpetual programmatic fight for corporate wellness industry providers to sell the benefits back to the individual. Where COVID came in, it actually flipped it. So the employee was saying to their employer, "Hey, boss, what can you do for me? I'm working from home. I've never been so isolated and withdrawn from my social interactions. I'm gaining the COVID kilos, and I don't know what to do. I'm stressed out. I'm overworked. And what can you do for me? Health is now important, more important to me than it ever has been." So it's really flipped that a catalyst of a conversation between employee and employer, from the employer to sell it to the employee to ask for it. And that's great. I think where HR has really tried to navigate this whole, shake up has been, okay, we've got business continuity plans to adhere to. We've got to figure out, is our workforce size changing? Are we retrenching? Are we growing? What does that do to the day-to-day work? And now it's more shifting from that acute response into, okay, we're planning to work with this for a long time, and we need digital platforms to help facilitate and just bring that connectivity in. So that's where we come in.
Very good. Yeah, no, look, the COVID-19 is a real thing, right? It's the other COVID-19. Yeah, but so what's the competitive landscape look like? I would imagine that there's a number of health and wellness companies that want to create some kind of platform and bring in all these different things to help these companies where they realize, look, we have these larger workforces that we need to look out for, So what does it look like right now?
Look, it's a big industry. Even prior to COVID, we were almost a $50 billion industry just within corporate wellness. And I say that because our business capabilities extend outside of that, but that's where our legacy lies. The largest player in our space certainly is Virgin Pulse. So it's one of the Branson brands. They're a multi-billion-dollar company. Where the competition starts to thin out is with international capabilities. So we're in multiple languages, and you've got to personalize. Just a generic cookie cutter approach to these types of initiatives doesn't work. And so we've seen that with populational health. So if you can localize to different cultures, different languages, different content styles, which is what we do, that's where we really start to cut out. And we're coming from that, arguably most diverse series of countries in the world from Asia Pacific. You go from Singapore 20 minutes that way and to Malaysia 20 minutes that way, and I'm in Indonesia, and I've got an entirely different attitude, language, cultural set. So we've got to work with that, and that's very difficult for companies that don't have exposure to that. So it's a real advantage for us coming from Asia Pacific outwards to the biggest markets in the world in North America and the UK.
Absolutely. You know what? I can totally relate to the Virgin Pulse. My wife at her work, they have Virgin Pulse, and she gets on me all the time to always update it because it actually helps with your health insurance.
100%,
So I would assume you guys have the same model.
We do. So we white label for a couple of insurers down in this part of the world, but there's some great research and reporting back from John Hancock in the US, one of the oldest, largest insurers in the world, that they have extended lifetime value out of a policyholder anywhere up to 21 years. So you're living longer, paying more premium. But the kicker here is that they have up to a 30% reduction in hospitalization costs. So they're more profitable and living longer. It's great business for insurance companies to offer this to their policyholders. And that's one of the functions that we offer. So it absolutely works. It's great business sense. And it's good to take some of the strain off a healthcare system that at the moment is under siege from this pandemic. So, we're fighting the good fight.
Absolutely. Absolutely. I mean, just curious, what kind of revenues have you guys done so far? I mean, I'm assuming it's a relatively newish company in the last year or so, or a couple of years.
Well, we've been operating for a few years now. So we've been building out the enterprise model for we've been operating in revenue for about 5 years. So last couple of years we've doubled year-on-year growth. We're looking to continue that. We've actually just taken on some a listing capital round through Canaccord and through Gravitas. So we're now capitalized to grow. So we'll turn our last year circa a couple of $1 million in revenue, and we'll be looking to double and triple that year on year from here. And one of the strategies that we've got doing for that is, we've got a 10x investment into sales and marketing just this calendar year compared to last year. So that's one way that we're helping to support that growth. And it's a rising industry. There's a rising need. So we're certainly very buoyant on what the next 12 and 24 months brings.
Very good. That's a perfect segue to my final question before I let you go here. From what you can tell us, what would you say are some of the growth drivers for the company now moving forward?
Look, we'll double down within corporate wellness, and it's bringing further sophistication to an algorithmic, machine-driven personalization capability. So that remains. Where the real exciting and the blue sky comes for us is that as we go further down that continuum of care towards that higher need use case, we've got a factory building a smart health hub and a wearable for ourselves for a higher needs patient, which brings in auditory continuous monitoring of some of your vitals, and that implies a more empowered consult to the physician as well as to the individual. So bringing in that software hardware hybrid to really bring a proactive approach to virtual primary care is where this business goes. So we've got breadth in corporate wellness, and then we go very deep with a virtual primary care offering, which will go into clinical trials later this year.
Very good. Well, Scott, with that, where can our audience go and find more information about Wellteq?
So website is www.wellteq.co, so WELLTEQ. LinkedIn is a fantastic area to contact us on, and email is hello@wellteq.co.
Awesome. Well, Scott, thank you so much for joining me today. I really do appreciate it. Good luck, stay safe, and I look forward to our next update.
Yeah, look, thanks for having us, Robert, and to SNN. It's a great platform, so I appreciate your help, and thanks to the audience for listening in.
Thank you.